Then I wanted to introduce our first speaker, Dr. Han. He's a professor and director of the Sleep Center in the People's Hospital at Peking University. Dr. Han is also a polio survivor himself. He's come all the way from China just to help us. He gave a talk yesterday at ResMed, and now he's here to give us a talk today. His main research emphasis is respiratory control in patients during sleep, and also childhood narcolepsy, and also non-invasive ventilation. He's published over 100 papers that have appeared in peer-reviewed journals, and he's also the president-elect of the Chinese Sleep Research Society. So please join me in welcoming Dr. Han.
Good morning. Dear friends and dear colleagues. It's really a great honor for me to be here to tell you something about polio inside China. Today, I think I have two status, both as a polio survivor and also a medical doctor. And hopefully this is the first opportunity for us to have further cooperation in future to benefit our post-polio people inside China. And this is I think the first record about this polio in history. It has a it's a long time ago. And in China, I think the first record about polio was in 1882. And the earliest record about the pandemic of polio start from 1938. That's we had about 30 provinces, and half of them actually had polio cases reported. In 1983, the polio first recognized officially by government as mass-report infection disease. Actually, these three dates or year, this was in Qing Dynasty. This was before the Communist Party took power. This is the Communist Party. After the Communist Party took power. And in 1960, we had the vaccination program. It starts in big cities, relatively small. At 65, we had this vaccination program in small villages. But it was not so popular. Such as me, actually, I was born in 1968 and still got the polio. And after that, we had many times a big pandemic of polio. And 1978, we had a planned vaccination nationwide program, but it was not so good. 1994. The last new polio cases were reported in Hubei province as South China province, and it was recognized the last polio in mainland China, and 2,000 years, this 0 new polio cases were recognized by WHO in China. That's a brief history of the development of polio in China. And for the instance of polio in China, I think the earliest record were from 1959. And till to 1994, we had the cessation of polio new cases. And so this year we had the instance of about 5 in, I think, in 100,000 people. And this is 60s, 70s, and the late 70s, early 80s, and we had a gradually decrease of incidence of polio. However, we had this increased number here in the late 1980s. The reason was not so clear, but definitely was due to the ignorance of this vaccination program by the government. And for the absolute number of polios, we also have this start from 1978. Actually, it's my understanding is it's the time for the U.S. There's no new polio cases right this time. But in China, we just start, say this is a number plus 1,000, and we still have a big number of patients, new polio patients. And here, exactly the same as here, the instance, we have a big increase of polio patient number. And before this 70s, we had annually report cases about 10,000 to 40,000 or more. This start from 60s, but before 60s we did not have any record. But I'm sure that we had the polio patient because now I met a lot of elderly with the polio problem, and they got the disease before the 60s. And here is the example of 1987, quite late to early 1990s in Shandong province, which is a province with a lot of polio survivors. Also, this province, they had a very good system to get the statistic analysis of polio situation. And here we also see as increased number of here, but here we see a very rapid decrease of number of polio patients because of this enhanced vaccination program. It's if you remember, it's quite similar to the situation here and the situation here. For age distribution of the polio patient in China, I think this means the offset. In 1990s, 1991, 1990, we had the exact numbers for this around 10 years old. We had, of course, this is similar to the international trends. The polio actually had the onset of symptom in very young children, but still we have a lot of with older age. Like each year, 3 years, we had this number of the patient new cases, even in 1990s. And in regard to the vaccination relationship to this new onset polio patients, still there's, of course, if no vaccination, more patient, but still if you have a vaccination program and got the vaccination, still have some cases reported. See, this is the number of the first about the mortality and the second instance at vaccination of polio in Shanghai, China. This is a big city, and they had very good numbers since 1956. So here is the instance. Here is the mortality that caused death of the patient, death rate. And we had this OPV program, vaccination start from 1960s in big city. It's like Shanghai. This is the capital, economic capital of China. And so here we saw a decreased trend due to this vaccination. And however, this immunization rate of the general population is still very low. So we still have had a very high incidence of polio. Here, we have a regular vaccination program and later the enhanced program. And so we saw the high rate of immunization in general population, and also we saw decrease of this polio incidence as well as the mortality. So definitely the vaccination program is key issue to stop the polio pandemic. And in regard to prevalence, that's how many people inside how many patients with polio inside general population in China. We had an estimated number at least 2 million. We don't have an exact survey on this issue, but there are different resources we can say. The first, the second China National Sample Survey on Disability that's finished in 2006, and they report this is the patient, the people actually with this lack or exercise problems, and actually the polio was the fifth cause this problem. So we get a number about 2 million. And for the prevalence estimate by experts in polio area, seems that we had these numbers about 3 to 8 per 1,000 population. This is the number population of 80s to 90s. So definitely we have more than 2 million polio survivors now. It's a big number due to this big population. And also we face new challenges. Even now, since 1994, we declared the disappearance of polio in China. However, we still have new polio cases due to the transmission from other countries. Here is the borderline of China with the other countries. Here is this is China, and here is about like Vietnam. And see this Yunnan province here. This was due to input from I think Vietnam area in 1995. After 1994, we declared the cessation of pandemic of polio in China. We had about 4 cases. In 1999, we had 1 case. I think it's close to Tibet here, probably from this area. We also had the polio outbreak in this Xinjiang area. It's right here. It's a borderline to this Pakistan, to India, and all these areas actually had polio outbreak last year. This was a map from New England Journal of Medicine, and they have also update numbers. I think this area still have a polio outbreak till to the early, middle this year. I'm sure this later they will have another occurrence of polio new cases. So this we face the challenge. We don't have inside, but we do have input from other areas. This polio really is an international problem. It's not only a national problem. Especially we have this more communication amongst international communities. So we face a challenge. And the second challenge was the polio induced by vaccine. And see this VPP cases, actually, the incidence was reported across the world, and about 1 to 2 per million of population. That's the international report. Also, the incidence in China is exactly the same number. And here is the calculation of the polio new cases from 1980s to 2005. And see, China still have account for 9% of the total new polio cases in the world. Of course, India was the largest because of this big population. And others. See, these Vietnam, Pakistan, India, Afghanistan are all China's neighbors. So definitely it's a big challenge for us. We may not only consider ourselves, we need to pay attention to our neighbors in case any input of polio. We also did a study on economic burden of polio. This was the paper published in 1996, just after we declared the cessation of polio pandemic. People did the calculation for the treatment, like recovery and rehabilitation. Just for acute cases with polio, we spend like US dollar. Here is a very small number. And but the long-term loss due to all new victims of polio was about 0.3 billion US dollar just this year. It's a huge number, really a big burden to the society. And also, polio causes social burden, especially in China. Still, there are a lot of discrimination to this handicapped people. And see here, for this about 2 million of Chinese people with polio, and I think we had the first China national sample survey on disability. It's about 15% of this like exercise problem was caused by polio. It's ranked to the 5th of the all causes, including accident, including everything. But polio was the only one disease mentioned by the survey. And also, about 20 years later, we did the second survey, the same population, but may enlarge or get older, still the 5th, this number, 7%. But this decrease of the absolute percentage was due to the increase of the people with exercise problem. As we had older population, we had more car accident, we actually also reduced the criteria for this evaluation of the exercise problem. So here, but still the 5th, as this was only mentioned single causes of this disability. For their daily life, this was a survey finished in 1996. I think the same group of people to study the economic burden. So about 44% they totally or partially loss of self-care. They cannot live by themselves. The most important thing is actually most of those people live in small villages. They need to survive themselves by go to farm, go to field, but it's very difficult. It's a movement problem. They cannot go out for entertainment, shopping like the general population. It's account for about 36%. And also the enrollment to school is about 30% had difficulties. It was not only their physical problem, the major was due to the society discrimination. So this is a very severe problem. Actually, for this school problem, they did the calculation, found out it's before 15. It was not a problem for you to go to elementary school. It's a low level. But if you try to go to higher school, really big problem. And for laborers, and because people need to work as a farmer or survive themselves, actually we had about 12% of these kind of survivors totally lost the ability to do labor work, and about 73% actually partially lost the capacity to do this field job. So this really caused a big problem. In regard to employment, actually polio patients had more problems. See, this is control about 1 million people, general population. This is about 1,500 post-polio patients. We had a really difficult situation like enrollment, marriage. Only 1/3 compared to the age-matched population, 2/3. So, as school problem, and also the good thing was social communication for these polio patients. Really, we don't have a big problem as compared to the general population. They are relatively smart. So for the higher education, later I will talk about this issue. We start from this polio patients because they don't have any mental situation. And we have seen that really polio caused a lot of economic and social problem in China. But how about the vaccination program? We spend money. Did we get benefit over the expenses? So this people also did the calculation during that time, 1996, before 2000 actually. This here is the cost for decrease 1 polio cases. Use the vaccination program. During the 60 to 70s, we spend this Chinese yuan about I think divide 10 for US dollar. As for this 70s to 90s, we decrease the expenses, and for 90 to 2000, because we need running many labs, running vaccine program for the general population, we had increased expenses. Or this, of course, after this, we declared cessation of polio panic in China, we may benefit more. Here, we spend less. However, even we spend money, but still we have net benefits. It's millions. We had the ratio of 1/8 and 1/8 around 47, we had one over 25. Definitely, these expenses or vaccination actually cause long-term benefit to society. We can imagine during the past 10 years, we don't have new cases of polio, we actually would gain more benefit from this vaccination program. The reason we need to think about this issue is that now people consider, say, we had the cessation of polio panic. Why we don't stop give the vaccination to general population? First, I think you spend less a small amount of money, you also actually gain benefit in future. And second, we also face a very severe challenge for polios from other countries or even inside China for this vaccination-derived polio. And if you think it's just a very small number, but we have very crowded community, we have a big population base. And if any new pandemic really cause problems, especially when you think about probably 20, 30 years later, you don't give vaccination to now generation, Then we talk about the research in polio area in China. First, we had the network with one national lab at 30 province level polio labs. They are now still running to detect the polio virus. Because we had a different kind of paralyzed cases across country caused by other virus or other reason, and we need to do the survey to confirm or exclude the diagnosis of new polio cases. I think this costs money, but still it's running. In 1984, the first symposium on polio took place in Shandong province. It's the same province we mentioned before, but majorly was responsible by surgeons. Yes, the reason was during that time we just had a setup of a Chinese Federation of Disabled Persons. Just after the open policy, we had a very high official, the son of Deng Xiaoping, the former leader, who actually was injured, get paralyzed, and after the open policy in early 80s, Deng Xiaoping took the power again. So his son was sent to U.S. and Canada for treatment of this spinal cord problem. And after he returned from North America, he realized something to do. So he set up this Federation for Disabled Persons. And at that time, the surgery treatment for this post-polio people was quite popular. And so they formed the organization, the Polio Research Association, and they also published the journal, Polio Research. I don't think it's still very popular now, but during that time, really a big issue. And also they did a lot of surgery to try to make the people walk better. But the only thing they stopped there is the surgery. Really, we don't have a lot of neurologists and also physicians to be involved. And they published paper on polio in Chinese. We did the survey of this Chinese-based literature like PubMed in English, and we start from 1979. That's the start of the database. If we use polio as a keyword, we had about 1,500 published papers, but mainly vaccination, over 90%, and surgical treatment. And a few of them just mentioned about this post-polio, like respiration, cardiovascular effect, and other things. And treatment, you might be interested in traditional Chinese medicine. I will give you an overview here, and for both acute infection and chronic comorbidity. It should be mentioned that we don't have a RCT research clinical trial or all of this published data. That's really a pity. The first is about the traditional Chinese medication combined with Western medicine in acute polio therapy. Especially we focus on this like herbal medication. This was in 1968. Still very early, and they had this infection disease hospital, and they used the herbal medication combined with they call Western medication. During that time, as we had a close relationship with the former Russia, and I think the only thing had the effect was they call Western medication a kind of a neural stimulus. That's the conclusion. And the reason we think about this virus infection disease, Chinese medication, especially herbal medication, might work was from the experience of H1N1 infection, this flu. Last year, the doctor in Beijing actually conducted a very good RCT control clinical trial published in Annals of Internal Seems this Chinese traditional therapy can shorten the time of fever. It's a cost benefit. But for polio, it did not see that effect. And the others was about acupuncture for acute cases. No effect or efficacy in regard to how many percentage of patients actually benefit a lot, but may shorten the duration of recovery of muscle tone. Yeah, the report was that probably for the natural history, if you get paralyzed, probably need 2 weeks to recover for most of the patients. But if you use the acupuncture together, combined with the common treatment, may just shorten the recovery time to 1 week to 10 days. And how about acupuncture treatment for chronic polio comorbidity? They did the observation using EMG, this muscle activity measurement, to do this. And so this thought that about 78% of the patient actually get benefit. That means after the certain time of acupuncture, probably the muscle tone and also the neural activities recovered significantly. So they suggest a kind of acupuncture or this chronic disease. But as I mentioned, this was not a placebo controlled study. You really don't know it was due to the acupuncture itself or just you have like a rehabilitation program to do more exercise or something like that. And another research was about Qigong. That's Qigong, that's a kind of, I don't know if you know about that things. You saw the TV program, the people just use that's kind of a qi, that's inside the element of Chinese Qigong. This study was done in my college, medical college, in 1987 or 88. I was aware of the subject because this exactly was from my classmates, because we had about 32, 33 polio in my medical college classes. And this, the author was my teacher in physiology. I remember that when we were just arrived at the hospital several weeks later, we were asked to participate in a program to measurement EMG activity. And later we attend exercise class as majorly to use Qigong for exercise. Then 10 months later, we also did the same measurement again. So the major finding was after 10 months of Qigong practice, actually for this about 30 students, we had an increase of EMG activity. This is the amplitude. That's how strong your muscle act. And this is the frequency of the electricity activity of the muscle. See, this is overall, this about 30 students had an increase of the frequency of activity in their muscles. And also they divide the people into mild, moderate, severe cases. Seems the mild benefit more. So they have a faster frequency, yeah, probably also the strength of the activity increased more. But for severe one, yeah, benefit a little bit, but not very much. It's quite reasonable. And say if you have a good good base, and more exercise or Qigong may benefit more. It's the same problem. You don't really know, is it because of Qigong or because of just exercise training. I remember that during that time, before we were enrolled to the medical college, we just attended the common high school with the normal people. I remember for myself, I was very shy during the time. I even did not want to walk. I never attended the exercise class in high school. So when we went to college, we have a lot of people, polio students. And we just worked together. We actually increased a lot. And we did a lot of exercise. I think that's a major issue, that to increase the activity of your muscle. It's kind of training. So it's my personal view of this problem. So this is something about, I think for this traditional Chinese medicine, really we need, sometimes it works, no matter it's by itself or just by training or like a rehabilitation program. And however, when we think about this late effect of the polio, now we have about more than 2 million polio survivors. So still, we need to focus on this late life of these people. Unfortunately, lately, I did not find a lot of literature in Chinese about this issue. That means really few people care about that, especially for these physicians, neurologists, even pulmonologists. The reason the medical community concerned about this polio issue, especially post-polio issue, was due to the surgery. They did surgery. And when I check back the background of these surgeons, as actually there were no professors from very good medical university. All those people actually were from relatively low level of hospital, and they all had a background of military service, because they treat this wound in regard to war or something. Then later they turn to this polio survivor. And for this post-polio syndrome, actually the first report was also by this person who was a surgeon to do surgery. And he published the review introduction of the post-polio syndrome in 1992. It was not so late. It's my own understanding was that this syndrome was named in middle 80s, I think, in the world. And however, even in this year, still there are case reports about 3 cases in a relatively good journal. And totally, I think we had less than 20 cases of post-polio syndrome reported. And of course, there are almost no cases reported in regard to the treatment, especially treated by this non-invasive ventilation like BiPAP or so. And for this, the biggest case report was from Taiwan. It's just the focus on mechanism, see this physical activity, the muscle enzymes, no treatment effect. So definitely we need to do more to take care of polio, post-polio syndrome patient. However, we had a very good epidemiological study in 1996, also actually organized by a surgeon during the time in the same province, in Shandong province. They did the survey of this area. They studied, they have 10 counties. In China, we have counties, province, there's nation. Like the province is equal to state. And the counties, like counties here, and in that 10 counties, that area, they had about 30,000 post-polio survivors. And this account for about 260 per 100,000 population. It's quite a high number. And they select 2 counties with about 4,000 post-polio survivors over 20 years old. And so they did the EKG, it's cardiac measurement, X-ray, lung function, very simple. They just measure the lung capacity. And the system evaluation, say they evaluate how severe, which muscle actually was damaged. They had a calculation, and they found out 800 with post-polio syndrome. This count of 18% of post-polio survivors during that time. The age was about 24 to 57, and the peak age to develop this post-polio syndrome was about between 33 to 49. And this number is quite similar to the report in literatures, and also male a little bit higher, about 65%. I think the literature report in the Caucasians, I think it's about 2/3 seem quite similar. And they also look at the symptom of this post-polio syndrome. See, the fatigue, weakness, pain, cold feeling, this number, and male, female. And also they have dyspnea during exercise or during rest. And each of these things, they did not have a severe psychological problem. That's good to say. And others like edema, like morning headache, we know now it's quite related to this sleep hyperventilation and sleep apnea problem. So still relatively about 1/3. If they get older, get weaker, sure, this will be a big problem. So this must something we should look about. For risk factor for post-polio syndrome, first they have the severity of the onset symptom. If mild, moderate, severe, if more severe, more possibility to get this post-polio syndrome. And also the onset age. If you had a very early onset age, probably less possibility to get the post-polio syndrome. If you have a very late stage age to develop the polio symptoms, more possibility to get this post-polio syndrome. There is some initial analysis. So definitely we need to look at the post-polio syndrome problem, and it's definitely is not just a leg problem. That's the situation in China. Always think about this, how it looks when you walk, but never think about how you breathe during sleep or during daytime. It's the most important things. So this is something I like to tell you about my personal idea about this issue. First, I had a special college life in China, and also I had the experience in sleep medicine. As if you look at this problem from a point of view of a sleep specialist, definitely probably post-polio syndrome related to more to this breathing during sleep. And also I have the personal experience in Cleveland. I think I stay in Case Western Reserve University between 1999 to 2001 as an assistant professor in sleep lab, work with Dr. Kim Strong. And this is the first time I actually read the literature about post-polio syndrome in the VA hospital, Cleveland. And also I had the opportunity to visit Dr. Ding, some people here may know this name. She is a professor in British Columbia University. Because it's 2005, I had the opportunity to visit sleep lab in that university. When I crossed the hall, the first I saw a polio clinic, and also a very severe Chinese patient was there, and we talked about this issue. And it seems she developed very good polio program. And also Dr. Farrell, the CEO of Resman, visited Beijing last year. We had a very good talk. He knows the situation of this polio problem in China, and so this is why I'm here. And actually with the help from Angela and the colleagues, had some opportunity to share some experience in this China Polio Society. This is my college. It's in a very small town in Shandong province. The reason I went to there because I finished my high school in 1987. During that time, just the recovery of everything of China, and it was very difficult for people with polio to go to higher education, college, universities. It's almost impossible. I was fortunate that in 1985. It's the son of Deng Xiaoping actually worked with this university to launch a special education program. Every year they enroll about 50 students with very high score to go to medical college. So this was the opportunity I had higher education, and this is my classmates. This is exactly the picture of my class. I was somewhere, this is Yellow River, during 1988 spring, we went outside, so to do something. This is my classmates. I still remember the name of each person, and this is 1988 spring, I think. And later, this is a new generation of the students inside this medical college, and here they practice, here they prepare for seeing patient. As you can see, they had different kind of difficulties, but major, we know this is polio. This polio. Let's see, but this is a new generation. This year seems the polio student decreased, but the students with these neuromuscular disorders actually increased. You can see the change of this past 20 years. Yes, it's here and here. And here in this college, we learn medical skills to practice, and we also had the opportunity to do the rehabilitation, like do surgery, and also other kind of like psychological rehabilitation or something like that. Here is the, probably you can go back a little bit. This was not the start of the, this is, I think it's still, just several years ago, this was polio. He could not walk, just need to touch the ground, and later he did the treatment, and at least he can stand up. So that's a kind of a program we did. And later I graduated from the medical college and had the opportunity to continue my study as a postgraduate student in Beijing University. This is my hospital. I had the opportunity to run this 10-bed sleep lamp. At the same time, I work as a pulmonary physician. This is sleep bed. I have a group of people, technicians. This is a lamp. This center. This is Dr. Kim Strong, who is a major, pulmonary physician in this area. And the good thing, not the good thing, but the thing was that his mother was a polio survivor. So when we met in Germany and we talked a little bit about, of course he did not care about this polio issue, but he really supported me to do this polio things. And I remember in 2000 when I was trying to return to China and talk with, of course, I had my parents and my family in China, and also I think I thought I should do something for this polio people. It's a major reason I like to return China. First, I thought about to get involved in some political activities, like work with the Chinese Federation of this. But later I found out if I do things from a point of a sleep specialist, it may play more roles of this issue. So, and also one thing was in 1999, I think Barbara recognized this lady. It really impressed me because that was the 7th International conference on non-ventilation. And actually, she used the band. Pneumobat, yes. And we can hear the noise here. And I was impressed by this treatment. And actually, I saw the hope of non-invasive ventilation as well as advantage of a sleep specialist. I also saw this polio patient with this non-invasive ventilation. And we know that during REM sleep, actually the neuromuscular disease people develop oxygen desaturation. It's a very early sign of damage. So why we don't start from this point to treat the patient early to get more benefit? And probably also the post-polio, like fatigue, like feeling not so well, probably is related to something. This also a patient, one of my good friend, treated in 2002. He was a very successful doctor at running a private school and adopt about 40, 50 post-polio children. And he also a polio survivor, was misdiagnosed as a cardiovascular failure. So he had polio, and he used this PEP machine for 10 years now. Yeah, everything is good. He's still running that hospital. Of course, unfortunately, he died this year due to the infection. Yeah, probably related to polio, but definitely not was due to this renal failure. So that's some initial experience. Also, we did sleep with sleep study with a very simple oximetry. See, this is the typical REM-related hyperventilation. This is quite common in polio patient. Of course, this lady had symptoms, others even without symptoms. Still, this was a professor in my hospital, and he just had an arm problem, no leg problem, nothing. His wife actually, he complained about his snoring. He never knows about that. When we did the PSC study, clearly REM-related desaturation. So this is the early sign of damage. We should start from here. And for my own experience, that's me. I see some of you saw this picture today, and this is Tibet, about 4,300 meter high. I had 60 times per hour for oxygen desaturation, like apnea index. I had a mean value of 67. When I went down to this city, 2,600, had this desaturation index of 14 and mean value of 87 during sleep. When I was in Beijing, just occasionally simple snoring, nothing happens. Why I developed so many? Of course, this high altitude was a challenge. However, I think something related to this polio. Look at this. This is in 2,000 meters. This is the second city. I slept in the same room with another physician at the same age, at same body BMI. However, this is me. When I went to sleep, clearly a decrease of oxygen level here. And also these things, I think it was related to REM sleep. But for this person, yeah, he also developed like probably periodic breathing. It's very common in high altitude, but not so low. I think this polio really plays some role in this thing. Definitely we need to look at. And the third, the last, I think we had this polio community in my medical college. This from 1985, the first class, till to last class this year. And we had the post-polio here, the major. and we had the neuromuscular disease, we had others. Here we saw dramatic decrease of this enrollment of the post-polio and other disabled person because the Chinese government changed the policy. They opened the door to everybody. They can go to college. So this is something. And we had about total this number of the students, my classmates in this medical school, and we had about 500 with post-polio survivor and about 100 neuromuscular disease and others. Age now about 20 to 50 years is right age for post-polio development, and all with a medical degree of bachelor, and 1/3 had a master or doctoral degree. They almost all of them practice medicine, and 2 died due to the neuromuscular programs, and where polio died of accident. So I'm thinking, what should I do for these people? Then we need develop a post-polio management system, increase recognition and monitoring, treatment, extend to neuromuscular management in future. So that's my major thinking. As I'm a medical doctor with this polio problem, and also my specialty in sleep medicine. We have this natural group of post-polio patients. They are medical doctors. They are quite easy to work with us for this issue. When we start from this group of people, then extend to the general post-polio survivor in China, as well as neuromuscular disease. So this is my thinking, and definitely we need this international cooperation. I take this very good opportunity to look forward to work with you in future. Thank you very much.
For just one question, if there was one question.
I apologize. You mentioned the Qui-Gon effect on chronic polio. Is that the acupuncture that you were speaking of?
No, it's a different thing. Acupuncture, we use the needle to... it's kind of special exercise. It's just very slow, like they have some movement. Also, they think about something, say, like inside you have a kind of special energy, to go everywhere to the key point or something like that. It's just like yoga in India or something like that.
It's meditation to bring your chi forward. It's meditation to bring your chi forward. And they do it in San Diego at the park. They do it in Riverside at a park. And it's usually the elderly Chinese people that run it.
Yes, it's correct.
Anything else?
I still don't need a microphone. What I want to know is, I've been on the BiPAP 7 years, but I'm having trouble finding doctors that can distinguish whether I'm having polio pain in the chest or whether it is condochondritis. Is there a particular way you can distinguish between the two? Because I've been told I have both, but I don't know how to deal with it.
It's the chest pain.
Yeah.
Right.
Yeah,
actually for the, one of the major symptom of this post-polio syndrome is pain everywhere, especially the joint pain or something. But I don't specifically you had this chest pain. And also I had experience with this non-ventilation, and people especially with sleep apnea or this lung problem and the chest wall problem, they had an increase of the volume. And so they had a pain during early days, but I don't know if this pain should last so long. Yeah, because it's too, get worse. And I don't think it's related to the ventilation itself. Yeah, probably do you have other problem like esophageal reflux or something like the chronic pain? I think first you need to see your physician and to find out what the reason was. Yeah.
Thank you very much. And I'd also, again, like to thank Dr. Farrell and ResMed, because when Dr. Farrell went to China and met Dr. Han, he felt like we should have increased collaboration. So we're very grateful. Thank you.